And the Parliamentary Health Committee has recommended that patients in public hospitals should not be charged for personal protective equipment used by the doctors. The committee directed the Ministry of Health to ensure PPEs lying at the Kenya Medical Supplies Authority, KEMSA, are distributed to all public facilities within 14 days. These were among recommendations issued by the committee during a meeting with the Ministry of Health and the Doctors' Union, as well as NHIF, SRC, and university heads. Let's get more from our very own Raquel Muigai.
Good morning. My name is George Aduda.
The Parliamentary Health Committee made a raft of recommendations to be achieved in the next 7 or 14 days by relevant authorities to avoid industrial action by doctors from the 7th of December.
Treasury to release the 500 million set aside in Supplementary 2 to NHIF within next 7 days.
If the funds are put into use as it should be, health workers in the targeted 19 counties will enjoy medical cover. However, that does not sort out the issue of COVID-19 medical emergency allowance that only lasted for 3 months. The Kenya Medical Practitioners, Pharmacists and Dentists Union wants the allowance to be encompassed as an enhanced risk allowance.
We would wish that that cover continues to continue to provide that level of comfort to the healthcare workers, but there are no resources to continue with this as advised by those who are responsible for resource allocation.
Now, if they want an enhanced risk allowance, there is a procedure for achieving that. They would discuss this with their employers. The employer would seek guidance from SRC, and we would give it, I assure you, Chair, with adequate reasons.
The committee recommending that the Ministry and KMPDU seek advice from SRC on enhanced risk allowance before SRC submits a report on the same within 14 days. Other recommendations set to be achieved within the next 7 days include that the Ministry of Health should provide enhanced medical insurance cover for medics on contract as they await to be converted to permanent and pensionable terms, as well as provide evidence that all staff in isolation are on payroll and have medical insurance. This after the union indicated that staff working in isolation facilities had no cover and were yet to be paid since August.
Ministry of Health, within 14 days to sort out PPEs issues in KEMSA and distribute the PPEs to all public institutions. No patient in public hospital should be charged for PPEs.
With the committee directing that the ministry ensures that it has also procured masks for vulnerable people, falling allocation of 300 million shillings. It also directed that all doctors who were dismissed in Laikipia and Kirinyaga counties be reinstated within 14 days.
All authorities, stakeholders, Ministry of Health, Council of Governors, the universities have actionable points that will be reviewed in a week's time.
This comes even as nurses await for the government to respond to their issues raised in a 14-day strike notice they had issued on Monday 23rd.
We are not going back to work to kill ourselves.
And while the country waits for resolution of the medical issues by the relevant authorities, 810 COVID-19 cases were reported in the last 24 hours, with 8 deaths recorded as well. Raquel Muigai, Citizen TV.